Of flu and other respiratory illnesses like RSV is here, and it's off to a nasty start, with doctors warning of a possible tri-demic on the way, throwing COVID into the mix.
Caitlin Rust has advice from local infectious disease experts in the midst of Halloween celebrations.
The hospitals are getting busier, the emergency departments are getting busier, and could really stretch the healthcare system if we get a convergence of all of these viral infections all at once.
The country relaxing all the pandemic protection of the past few years, viruses that cause coughs, runny noses, and sore throats are now on the rebound in the middle of crowded Halloween celebration.
Last year we were talking about twin-demics with the flu and COVID-19. This year we're hearing about triple-demics with RSV, flu, and COVID-19.
While COVID cases remain relatively low, doctors worry about how much of an impact all three of these respiratory illnesses will have in the next few months. The flu is already hitting the state earlier and harder than usual.
The Louisiana Department of Health reports that we're seeing about 6.7% flu-like illness, and our baseline is usually below 3.9. I mean, most of the time during the year, we're seeing close to 0.
LDH also reports we're up to a 10% baseline for RSV, affecting mainly children.
You can imagine that they might be more susceptible to infection and perhaps greater severity of infection because of the immunity not being there as it would have been in the past when these viruses were circulating consistently year to year.
Doctors are seeing these viruses predominantly in children right now, but they can quickly leak out into the adult population, and there are other respiratory viruses circulating as well as trick-or-treaters make their rounds.
It's really hard to tell from the symptoms alone. All of them can involve fever and body aches and lead to sore throat. Especially, I think, with Omicron, we've seen a lot more sore throat with COVID and fatigue. So it's really difficult to know, but pull out that home test.
The prevention is really simple, and it's nothing you haven't heard before. Wash your hands and stay home when you feel sick. Also, make sure you're vaccinated against both COVID and the flu.
It's here, and we're seeing lots of it, and as a result, you really should get vaccinated as soon as possible because it takes 2 weeks before your immunity develops.
Dr. Fred Lopez says the country is only looking at around 50% vaccination rates for both COVID and the flu right now. Dr. Catherine Baumgarten says the vaccines are safe to get all at once and that the flu shot this year is actually proving to be particularly effective against this strain.